Does caffeine interfere with blood thinner medications? Have you ever wondered how caffeine might affect your blood thinner medications? This is a great question, especially for those managing hypertension and stress. Let's break it down. Caffeine does not directly interfere with the effectiveness of blood thinner medications like Eliquis or Warfarin. Unlike vitamin K, which can impact how warfarin works, caffeine typically does not alter the function of these anticoagulants in your body. However, there are some important things to consider when it comes to caffeine and hypertension. First, caffeine can cause a mild and temporary increase in blood pressure. For individuals with hypertension, this spike can add to overall cardiovascular risk. So, it's essential to manage caffeine intake carefully. Both caffeine and blood thinners can slow down blood clotting independently. While caffeine itself does not directly increase the risk of bleeding, consuming caffeine around the time you take blood thinners may slightly raise the chance of bruising or bleeding, especially if other factors are also affecting clotting. Excessive caffeine consumption can lead to symptoms like jitters, anxiety, and an increased heart rate. These effects can be more pronounced in people on blood thinners and those with hypertension. This can complicate stress management and overall cardiovascular stability. It is also important to note that individual responses to caffeine can vary. Some people may feel stronger cardiovascular effects, such as a racing heart. If this happens, it is wise to discuss your caffeine intake with a healthcare provider. Maintaining consistent caffeine habits is key. Sudden changes in your caffeine consumption can affect blood pressure and heart rate. For those managing hypertension and stress, limiting caffeine can be beneficial. Reducing caffeine helps avoid temporary spikes in blood pressure and minimizes stress-related symptoms like anxiety, which can worsen hypertension. For individuals taking blood thinners, moderating caffeine intake supports safer medication management. This approach helps reduce the risk of increased bleeding and cardiovascular strain. So, while caffeine does not directly interfere with blood thinner medications, its effects on blood pressure, clotting, and heart rate mean that people with hypertension on blood thinners should monitor and limit caffeine intake. This can support overall cardiovascular health and effective stress management.